everyday habits that are destroying your kidneys. It's important to consult with a medical professional for personalized advice. Here are some habits that could potentially be detrimental to your kidney health. Not drinking enough water can indeed have negative effects on your kidney health. The kidneys play a crucial role in filtering waste products and toxins from your blood, and they require an adequate amount of water to function properly. When you're dehydrated, the concentration of waste products in your blood can increase, putting additional strain on your kidneys. Over time, this can potentially contribute to kidney problems and kidney stones. Here's how inadequate water intake can affect your kidneys. Decreased filtration. Insufficient water intake can reduce the amount of urine produced by your kidneys, leading to a decrease in the filtration of waste products. This can potentially contribute to the accumulation of toxins in your body. Formation of kidney stones. Dehydration can increase the concentration of minerals and salts in your urine, making it more likely for kidney stones to form. Kidney stones can be painful and may cause damage to the kidneys if not managed properly. Increased risk of infections. Proper hydration helps to flush out bacteria and prevent urinary tract infections. When you're dehydrated, your risk of urinary tract infections can increase, which can potentially lead to kidney infections if left untreated. Strain on kidney function. Chronic dehydration can put extra stress on the kidneys and potentially contribute to long-term kidney damage, especially if other risk factors are present. To maintain good kidney health, it's important to drink an adequate amount of water throughout the day. The general recommendation is to drink about 8 glasses of water per day, but individual needs can vary based on factors like age, activity level, and climate. It's a good practice to listen to your body and drink water when you feel thirsty. However, it's possible to drink too much water as well, which can lead to a condition called water intoxication or hyponatremia. Finding the right balance of fluid intake is important. If you have concerns about your water consumption and its impact on your kidney health, consider discussing it with a healthcare professional. Excessive salt consumption can have a negative impact on your kidney health, particularly when it comes to kidney function and blood pressure regulation. The primary component of salt is sodium, and when sodium intake is high, it can lead to several issues that affect the kidneys. High blood pressure. One of the most significant risks associated with excessive salt consumption is the potential for high blood pressure, hypertension. High sodium levels in the bloodstream can cause the body to retain more water, increasing blood volume and putting extra pressure on the blood vessels. Over time, this can damage the blood vessels in the kidneys and reduce their ability to function properly. Kidney damage. High blood pressure resulting from excess salt intake can lead to kidney damage. The kidneys play a crucial role in regulating blood pressure, and when they are under strain due to hypertension, their function can be compromised. Increased risk of kidney stones. Excess sodium in the diet can lead to higher levels of calcium in the urine, which increases the risk of kidney stone formation. Kidney stones can be painful and may impact kidney function if they obstruct the flow of urine. Reduced kidney function. Chronic high salt intake can lead to reduced kidney function over time. The kidney's ability to filter waste products and maintain electrolyte balance can be impaired. To promote kidney health, it's recommended to limit sodium intake. The general guideline is to consume no more than 2,300 mg (mg) of sodium per day, which is roughly equivalent to about 1 teaspoon of salt. However, for individuals with hypertension, kidney disease, or other health conditions, the recommended sodium intake may be even lower. To reduce salt consumption, consider these tips. Read food labels to identify high-sodium products. Choose fresh or minimally processed foods over heavily processed ones. Cook at home using herbs and spices for flavor instead of relying on salt. Limit the use of high-sodium condiments and sauces. It's important to note that some individuals may be more sensitive to the effects of sodium on blood pressure and kidney function than others. If you have concerns about your salt intake and its impact on your kidney health, consult a healthcare professional for personalized advice. The overuse of painkillers, especially certain types of nonsteroidal anti-inflammatory drugs, NSAIDs, can potentially have negative effects on kidney health. NSAIDs are commonly used to relieve pain and reduce inflammation, but excessive or long-term use can pose risks to the kidneys. Here's how overuse of painkillers can impact kidney health. Reduce blood flow to the kidneys. NSAIDs work by inhibiting enzymes that produce chemicals called prostaglandins, which are involved in inflammation and pain. However, prostaglandins also play a role in regulating blood flow to the kidneys. Prolonged use of NSAIDs can lead to reduced blood flow to the kidneys, potentially causing kidney damage over time. Kidney injury. NSAIDs can cause acute kidney injury, also known as acute renal failure, in some cases, especially when they are taken at high doses or for an extended period. This occurs due to a decrease in blood flow and disruption of kidney function. Fluid and electrolyte imbalance. Some painkillers, particularly NSAIDs, can lead to fluid retention and electrolyte imbalances, which can strain the kidneys. This is especially concerning for individuals with pre-existing kidney conditions or those at risk of kidney problems. Increased blood pressure. NSAIDs can lead to sodium and water retention, which can contribute to high blood pressure. High blood pressure is a risk factor for kidney disease. Interactions with other medications. Some painkillers can interact with other medications, including those that are metabolized by the kidneys. This can potentially lead to toxic effects on the kidneys or interfere with their normal function. To protect your kidney health when using painkillers. Use as directed. Follow the recommended dosage and duration of use as provided by your healthcare provider or on the medication label. Avoid long-term use. Prolonged use of NSAIDs should be avoided, especially without medical supervision. Monitor kidney function. If you have a history of kidney disease or other risk factors, consult your doctor before using painkillers. Stay hydrated. Drinking adequate water can help reduce the strain on the kidneys when taking painkillers. Consider alternatives. For chronic pain, discuss alternative pain management strategies with your healthcare provider. If you have concerns about painkiller use and its potential impact on your kidneys, it's important to consult a healthcare professional. They can provide guidance on appropriate pain management strategies and help monitor your kidney health. Uncontrolled diabetes. Uncontrolled diabetes can have a significant impact on kidney health and is a leading cause of kidney disease. Diabetes is a condition that affects how your body processes glucose, sugar, leading to high blood sugar levels. Over time, high blood sugar levels can damage blood vessels and organs, including the kidneys. Here's how uncontrolled diabetes can affect kidney health. Diabetic nephropathy. Diabetic nephropathy, also known as diabetic kidney disease, is a common complication of uncontrolled diabetes. High blood sugar levels can damage the blood vessels in the kidneys, impairing their ability to filter waste and toxins from the blood. This can lead to a gradual decline in kidney function. Increased blood pressure. Diabetes is a risk factor for high blood pressure, hypertension, and hypertension can further damage the blood vessels in the kidneys. High blood pressure is a significant contributor to the progression of kidney disease. Proteinuria. High blood sugar and kidney damage can lead to a condition called proteinuria, where proteins, including albumin, leak into the urine. This is an early sign of kidney damage and can indicate the presence of diabetic nephropathy. Kidney failure. Over time, the combination of high blood sugar levels and kidney damage can lead to chronic kidney disease, CKD, and, in severe cases, kidney failure. Kidney failure may require dialysis or a kidney transplant to manage. To protect your kidney health if you have diabetes. Maintain blood sugar control. Keep your blood sugar levels within the target range recommended by your healthcare provider. This can help prevent or slow the progression of kidney damage. Monitor blood pressure. Regularly monitor your blood pressure and work with your doctor to keep it within a healthy range. Controlling blood pressure is crucial for kidney health. Healthy lifestyle. Adopt a healthy lifestyle that includes a balanced diet, regular physical activity, and weight management. These factors can help improve blood sugar control and overall health. Medication adherence. Take medications as prescribed by your healthcare provider to manage your diabetes and any related conditions. Regular medical checkups. Schedule regular checkups with your healthcare provider to monitor your kidney function and overall health. If you have diabetes, it's important to work closely with your healthcare team to manage your condition and reduce the risk of kidney complications. They can provide personalized guidance on managing your diabetes, including diet, exercise, medication, and monitoring. Early detection and proactive management are key to preserving kidney health in individuals with diabetes. High sugar intake, particularly in the form of added sugars and sugary foods and beverages, can have negative effects on overall health, including kidney health. Excessive sugar consumption is associated with various health issues, some of which can indirectly impact the kidneys. Here's how high sugar intake can potentially affect kidney health. Obesity and diabetes risk. A diet high in sugary foods and beverages can contribute to obesity and weight gain. Obesity is a risk factor for both type 2 diabetes and kidney disease. Type 2 diabetes is a leading cause of kidney damage, and managing blood sugar levels is crucial to prevent kidney complications. Insulin resistance. Consistently consuming high amounts of sugar can lead to insulin resistance, a condition where the body's cells become less responsive to the effects of insulin. Insulin resistance is closely linked to the development of type 2 diabetes. High blood pressure. Diets high in added sugars are associated with an increased risk of high blood pressure. High blood pressure can damage blood vessels, including those in the kidneys, leading to kidney problems over time. Inflammation. Excessive sugar consumption can contribute to chronic inflammation in the body. Inflammation is linked to various health conditions, including kidney disease. Increased proteinuria. High sugar levels in the blood can contribute to damage in the blood vessels of the kidneys, leading to proteinuria, excessive protein in the urine, which is a sign of kidney damage. To promote kidney health and overall well-being, consider the following tips. Limit added sugars. Reduce the consumption of foods and beverages with added sugars, such as sugary snacks, sweetened beverages, and desserts. Choose whole foods. Opt for whole, unprocessed foods that are naturally low in sugars. Fresh fruits, vegetables, whole grains, lean proteins, and healthy fats can provide essential nutrients without excessive sugar. Read labels. Check food labels for hidden sugars, as many processed foods contain added sugars under different names. Stay hydrated. Drink water as your primary beverage and limit sugary drinks. Control portion sizes. Be mindful of portion sizes to avoid overconsumption of sugary foods. Balanced diet. Aim for a balanced diet that includes a variety of nutrient-rich foods to support overall health. Regular physical activity. Engage in regular exercise to help manage weight, improve insulin sensitivity, and support kidney health. Remember that natural sugars found in whole foods like fruits and dairy products are generally less concerning than added sugars found in processed foods. However, it's still important to monitor your overall sugar intake and make mindful choices to promote kidney health and overall well-being. If you have specific health concerns, consider consulting a healthcare professional or a registered dietitian for personalized guidance. Excessive protein intake. Excessive protein intake, especially over the long term, can potentially have negative effects on kidney health, particularly for individuals with pre-existing kidney conditions. While protein is an essential nutrient that plays a crucial role in the body's functions, consuming too much protein can strain the kidneys and potentially contribute to kidney problems. Here's how excessive protein intake can impact kidney health. Increased workload. When you consume excess protein, your kidneys have to work harder to filter out the byproducts of protein metabolism. This increased workload can put stress on the kidneys over time. Formation of waste products. Protein metabolism produces waste products, including urea and creatinine, that need to be filtered and excreted by the kidneys. Consuming excessive protein can lead to higher levels of these waste products in the blood, potentially leading to kidney damage. Calcium imbalance. A high-protein diet can lead to an increase in calcium excretion in the urine. Over time, this can potentially contribute to the formation of kidney stones and negatively impact bone health. Risk for kidney disease. Individuals with pre-existing kidney conditions, such as chronic kidney disease, may be more sensitive to the effects of excessive protein intake. High protein intake could accelerate the progression of kidney disease in such individuals. It's important to note that not everyone needs to be concerned about excessive protein intake. Protein requirements vary based on factors like age, gender, activity level, and health status. Athletes and individuals engaged in intense physical activity may have higher protein needs to support muscle recovery and growth. However, for the general population, it's usually recommended to consume protein within recommended daily intake ranges to support kidney health and overall well-being. Balance protein intake. Consume a moderate amount of protein that aligns with your individual needs. This can help you meet your nutritional requirements without overburdening your kidneys. Choose quality sources. Opt for lean protein sources such as poultry, fish, eggs, dairy products, legumes, and plant-based sources like tofu and quinoa. Monitor kidney function. If you have existing kidney issues or concerns about your kidney health, consult your healthcare provider. They can help you determine an appropriate protein intake based on your health status. Stay hydrated. Drinking enough water can help flush out waste products and reduce the strain on the kidneys. Focus on a balanced diet. Incorporate a variety of nutrient-rich foods from different food groups to ensure you're meeting all your nutritional needs. If you're considering making significant changes to your diet, including increasing your protein intake, it's a good idea to consult a registered dietitian or healthcare professional. They can provide personalized guidance based on your individual health goals and needs. Smoking is harmful to virtually every organ in the body, including the kidneys. Smoking has been linked to a range of health issues, and its negative impact on kidney health is significant. Here's how smoking can affect kidney health. Reduced blood flow. Smoking leads to the narrowing of blood vessels and decreased blood flow throughout the body, including to the kidneys. Reduced blood flow can impair the kidney's ability to function properly and filter waste products effectively. High blood pressure. Smoking is a major risk factor for high blood pressure, hypertension. Hypertension can damage blood vessels in the kidneys and contribute to kidney disease over time. Kidney damage. The toxins present in cigarette smoke can directly damage the cells and blood vessels in the kidneys. This damage can lead to impaired kidney function and an increased risk of kidney disease. Increased proteinuria. Smoking has been associated with an increased risk of proteinuria, where protein leaks into the urine. Proteinuria is a sign of kidney damage and is linked to kidney disease progression. Reduced effectiveness of treatments. Smoking can make kidney diseases, such as diabetic nephropathy or chronic kidney disease, more difficult to manage. It can reduce the effectiveness of treatments and interventions aimed at preserving kidney function. Higher risk of kidney cancer. Smoking is a major risk factor for kidney cancer, renal cell carcinoma. The toxins in cigarette smoke can damage the DNA of cells and contribute to the development of cancer. Quitting smoking is one of the most effective ways to improve your overall health, including your kidney health. Here's why quitting is important. Reversal of damage. Quitting smoking allows the blood vessels to widen, improving blood flow to the kidneys and other organs. This can help slow down or reverse some of the damage caused by smoking. Lowering blood pressure. Quitting smoking can help lower blood pressure, reducing the strain on the kidneys and decreasing the risk of kidney disease. Reduced risk of kidney disease. Quitting smoking can significantly lower your risk of developing kidney disease or further damaging your kidneys if you already have kidney issues. Improved treatment outcomes. For individuals with kidney disease, quitting smoking can enhance the effectiveness of treatments and improve long-term outcomes. If you're a smoker and concerned about its impact on your kidney health, consider taking steps to quit smoking. Seek support from healthcare professionals, smoking cessation programs, or support groups to increase your chances of success. Quitting smoking is a positive step that can have far-reaching benefits for your overall health, including your kidneys. Excessive alcohol consumption. Excessive alcohol consumption can have negative effects on various organs in the body, including the kidneys. The kidneys play a crucial role in filtering toxins and waste products from the blood, and alcohol can impact their function in several ways. Here's how excessive alcohol consumption can affect kidney health. Dehydration. Alcohol is a diuretic, which means it can increase urine production and lead to dehydration. Dehydration can strain the kidneys and reduce their ability to properly filter the blood. Electrolyte imbalance. Excessive alcohol consumption can disrupt the balance of electrolytes such as sodium, potassium, and calcium in the body, which can impact kidney function. High blood pressure. Chronic excessive alcohol consumption is a risk factor for high blood pressure, hypertension. High blood pressure can damage the blood vessels in the kidneys and contribute to kidney disease. Acute kidney injury. Binge drinking or heavy alcohol consumption in a short period can lead to acute kidney injury. This condition is characterized by a sudden decrease in kidney function and can be life-threatening. Chronic kidney disease. Long-term excessive alcohol consumption can contribute to the development or progression of chronic kidney disease, CKD. CKD is a condition where kidney function gradually deteriorates over time. Interference with medications. Alcohol can interact negatively with certain medications, including those used to treat kidney problems. This can further compromise kidney function. Increased risk of kidney stones. Excessive alcohol consumption can lead to an increased risk of developing kidney stones, which can cause pain and obstruct the urinary tract. To promote kidney health and overall well-being. Moderation. If you choose to consume alcohol, do so in moderation. The recommended guidelines vary by country, but generally, moderate alcohol consumption is defined as up to 1 drink per day for women and up to 2 drinks per day for men. Stay hydrated. If you consume alcohol, make sure to drink plenty of water to counteract its dehydrating effects on the kidneys. Healthy lifestyle. Adopt a healthy lifestyle that includes a balanced diet, regular physical activity, and proper hydration. Monitor kidney function. If you have concerns about your kidney health, consult a healthcare professional. Regular kidney function tests can help identify any potential issues early on. Seek help. If you're struggling with excessive alcohol consumption, consider seeking help from healthcare professionals, support groups, or addiction treatment programs to manage your drinking and improve your overall health. It's important to note that individual responses to alcohol can vary, and some individuals may be more sensitive to its effects on kidney health. If you have existing kidney conditions or other health concerns, it's advisable to consult a healthcare provider for personalized advice on alcohol consumption.